On this Tuesday night, it's beginning to look a lot like an Omicron Christmas. The public health restrictions being reimposed as the variant is expected to be dominant well before the holidays.
It spreads so fast that we're always one step behind.
Where rules are being ramped up or relaxed, plus the need for more rapid tests. Ottawa's fall fiscal update, a lower than projected deficit, and the tens of billions in new spending. Who is this? Police ask for help identifying a suspect in the murders of a billionaire Toronto couple 4 years ago. And the Jane of all trades.
I think something's happening.
The next move for the woman who bartered her way from a bobby pin to a house.
Global National with Donna Friesen.
Good evening and thanks for joining us. As we approach the end of 2021, scientists are again racing to understand a virus that has upended all our lives. The Omicron variant is now reported in 77 countries. It is spreading faster than any other version of the coronavirus. Today, the head of the WHO had a stark warning about dismissing it as mild.
Surely, we have learned by now that we underestimate this virus at our peril. Even if Omicron does cause less severe disease, the sheer number of cases could once again overwhelm unprepared health systems.
Politicians and public health officials are again being challenged to keep hospitals from being overwhelmed. Some provinces are beginning to reimpose restrictions. In Quebec, people are urged to work from home. Ontario's top doctor says he plans to recommend new province-wide measures later this week. He calls Omicron a game changer.
I certainly hope that it is less severe, but we're planning for the worst, so equal to Delta. Hoping is not a strategy. We're taking nothing for granted with this rapidly spreading virus.
Just 10 days until Christmas Eve, and again Canadians, even those who are fully vaccinated, are being cautioned to manage their risk and get booster doses. Jamie Mauracher has tonight's top story.
It feels like we've been here before.
Everybody needs to decrease their contact rates considerably, and we also need structural measures in place to support exactly that.
Omicron is again forcing all Canadians to rethink how we spend our time indoors.
I think it's prudent and reasonable to treat every new case going forward as Omicron.
Ontario is banning unvaccinated visitors from long-term care homes and increasing testing for staff and caregivers. But with case rates in the province exploding, some are questioning why Ontario is stopping there.
This variant is so transmissible right now and spreads so fast that we're always one step behind.
Consider Kingston, where cases almost tripled over the last week. Experts have been floored by Omicron's R number, the speed at which it's reproducing. An R number above 1 indicates COVID is still spreading. Canada is sitting at 1.1 overall. That means 100 infected people will likely pass the virus on to 100 more people. But in Ontario, Omicron's R value is 4, meaning 100 people with the mutated strain will likely infect 400 others.
If it results in a fair number of hospitalizations, it will be very difficult for the healthcare system to absorb those numbers.
An outcome New Brunswick, Nova Scotia, and Prince Edward Island are trying to avoid, enforcing new gathering limits, restricting school activities, and implementing physical distancing requirements. For local businesses, it's a setback.
We've lost about 400 people in reservations.
But it may only be the beginning. Experts say doing nothing isn't an option, and each new measure triggered today may not have a meaningful impact for over 2 weeks. This is simply life in a pandemic.
You can't stop this. Omicron is going to dominate, and all we can hope for, I think, at this point is that this virus has just mutated itself so much that it's now going to have some disadvantages.
There's no question the news is exhausting. Unfortunately, if enough COVID-fatigued Canadians don't do their part this holiday, we could also be in for a tough start to 2022. Jamie Mauracher, Global News, Toronto.
British Columbia is reporting an uptick in Omicron cases. The BC government says there were 44 confirmed cases as of yesterday. None are hospitalized. Only 20 of them are linked to travel, which means the variant is spreading in the community. And new modeling shows in worst case scenarios, Omicron would lead to a major spike in cases in BC in the coming weeks. The province says it is working on the rollout of booster shots to get more people better protected. In Alberta, Premier Jason Kenney was widely expected to announce an easing of restrictions around holiday gatherings today, but a news conference planned for late today was cancelled. Instead, Premier Kenney will be joining a call with the Prime Minister and other premiers about the Omicron variant and how to keep Canadians safe, including if they travel abroad. Border restrictions are said to be on the agenda of that meeting. In Alberta, doctors are urging people to be cautious. Heather Yourex-West reports.
It's the week before Christmas and the mood's a bit tense.
Are you going to gather with lots of friends and family?
No, I'm not.
Keep it small.
Keep it small.
You're going to take care of the family.
Yeah, you're a little nervous about the Omicron variant?
Yes, very, very nervous.
On Monday, Alberta reported its first suspected case of community Omicron transmission. It is under investigation, Dr. Dina Hinshaw said in a tweet, and we will update Albertans as we learn more.
This is an important development. What we are learning in real time, unfortunately, from provinces to the east, specifically Ontario and Quebec, and even to some extent Nova Scotia, is this variant, once it's in the community, spreads very quickly.
It's why Craig Jenny says he's nervous about a lifting of COVID restrictions ahead of holiday gatherings. The Delta-fueled fourth wave in August and September hit Alberta's health system hard, and it still hasn't recovered. Intensive care units are still being stretched as patients continue to fill temporary surge beds. Normal capacity for the province is 173, but as of Tuesday morning, there were 186 patients in ICU here.
We're thankful that things have slowed down slightly, but we are functioning at a different level than we did 2 years ago.
With many scheduled surgeries still having to be delayed, doctors are also worried of COVID spread in the community. Alberta's answer, making rapid COVID test kits available to the general public.
When we're talking about the general public, even if they're not quite as sensitive as a PCR test, they're going to do a huge job in limiting the potential for outbreaks across the province.
Third dose boosters an incredibly important tool right now, too, especially for anyone planning to see family or friends. The pandemic's second Christmas is starting to feel a lot like the first. Heather Yourex-West, Global News, Calgary.
Some provinces are ramping up the distribution of rapid tests. They haven't been used widely across Canada, but there's a growing push to change that. Mike Le Couteur reports.
It is the must-have item this holiday season. Fitting in Halifax, a box with a bow was filled with rapid antigen COVID-19 tests, ready to hand out to anyone who wants a pack of 5.
My best friend's in Ontario and she's a nurse, and she is shocked at how easy we can go and obtain these and be able to keep our COVID numbers down, hopefully.
Keeping the numbers down by keeping track of the virus, even if it's not as effective as the gold standard PCR test. And as Nova Scotia, New Brunswick, and Saskatchewan make them widely available, other provinces continue to consider it.
There are people working to break them up into 2 at a time so that they're, because we can't give, if we give 25 to each person, then we won't have enough to distribute.
BC is waiting for supplies to ramp up before making them more widely available, while Quebec, which according to Health Canada, has only used 3% of the rapid tests it has received from the federal government, is moving forward starting Monday.
People will be able to receive 5 tests per person per 30 days.
Quebec will hand out more when they get more from the federal government. The fall fiscal update has earmarked $1.7 billion for additional rapid tests to be distributed to the provinces.
We are ordering 180 million more. We know that they can be useful. We know that they can make a real difference in our fight against Omicron in the coming weeks.
Despite that increase in supply, Ontario is still limiting rapid test distribution to school-aged children, businesses, healthcare workers, and people living in congregate settings. And that is frustrating frontline healthcare professionals.
We're 2 years and 4 waves deep into this pandemic, and it's quite shocking that we're still talking about the concept of distributing free rapid tests to people.
And if ever there was a case for their effectiveness, Finance Minister Chrystia Freeland is in self-isolation after 2 members of her staff used rapid antigen tests, and the results came back positive for COVID-19. Donna?
All right, Mike Le Couteur in Ottawa, thanks. And because some members of her staff tested positive, the finance minister delivered her fiscal update in her office today out of an abundance of caution, though she herself tested negative. Chrystia Freeland outlined a better than expected economic rebound that she says offers enough financial wiggle room for $28 billion in new spending. Our chief political correspondent David Akin breaks the numbers down for us. David.
Well, Donna, the Trudeau government plans to keep on spending. It has set aside billions it says it needs to fight the pandemic, help British Columbia rebuild, and improve health and welfare for kids on First Nations reserves. A stronger economy means many Canadians are back on the job, paying taxes, boosting government revenue. As a result, a deficit that back in April looked like it was going to be about $155 billion this year could be as low as $116 billion when the fiscal year ends on March 31st. But rather than bring down the deficit as low as possible, Ottawa will still borrow $28 billion for new spending. And that means the deficit this year will be about $145 billion. What will Ottawa spend the money on? Ottawa is putting aside an extra $13 billion this year to deal with the pandemic for things like pediatric vaccines and booster shots. There is also a set aside of $4.5 billion specifically to deal with the fallout from the Omicron variant. British Columbia will get $5 billion to rebuild after an unprecedented year of natural disasters. Finally, Ottawa will set aside $4 billion this year to address past harms and discrimination related to First Nation child welfare. Details on how that money will be spent is still to come.
These are prudent provisions. They're things we have to do. And this is a transparent accounting of where Canada's public finances are.
The opposition has a different view.
What they neglected to point out is how their mismanagement has led our country and Canadian families to the edge of an economic cliff, Mr. Speaker.
Now, Finance Minister Chrystia Freeland did flag 3 priority problems: inflation, housing affordability, and climate change. But she promised more to come on those issues in next spring's budget. Donna?
All right, David Akin in Ottawa, thank you. A new study out of South Africa reveals how the Pfizer-BioNTech vaccine performs against the Omicron variant. The data is from South Africa's largest health insurer. It's the first major private study since Omicron was detected. Researchers analyzed more than 210,000 COVID cases, 78,000 of them linked to Omicron. They found the Pfizer vaccine provided just 33% protection against getting infected with Omicron. However, it found it may offer 70% protection against hospitalization. Now to a high-profile criminal investigation in Ontario. Toronto police have released video of a person they say is a suspect in the murders of Barry and Honey Sherman 4 years after the billionaire couple was killed. The short video shows the suspect walking near the Shermans' Toronto home on the night of December 13th, 2017. Investigators have spent 4 years trying to identify the person, involving the FBI and the Ontario Provincial Police. They say they don't even know the person's sex or race, and they need the public's help.
It is our hope that someone will come forward with a name when they recognize the individual's walk, the way in which they kick up their right foot with every step, knowing that the person was or is connected to the Sherman family or was in the area on that day at that time.
The bodies of Barry and Honey Sherman were found in the pool area of their mansion. An autopsy determined they died of ligature neck compression. Barry Sherman was the founder and owner of Apotex, the largest producer of generic drugs in Canada. Their family is offering a $10 million reward for information that would help solve the case. An unrelenting rival for your favorite sports team. Coming up, how pro athletes are being forced to take on Omicron. British lawmakers have approved new restrictions to try to limit the spread of the Omicron variant, despite a revolt against British Prime Minister Boris Johnson from within his own party. Johnson needed support from the opposition Labour Party to get the restrictions passed. 99 of his own Conservative MPs voted against his plans to introduce vaccine passports for nightclubs and other large venues. The UK reported more than 59,000 new cases today. That is the highest since January. Omicron is now dominant in London. The city's public health chief says early data shows it now accounts for more than half of all new cases. And with Omicron spreading so fast, the UK government says its travel restrictions on 11 African countries are no longer effective in slowing transmission. It says it's removing the countries from its travel red list starting tomorrow morning. Pro sports are all about travel, and now new infections are quickly popping up across 3 North American leagues. Dozens of NFL players have tested positive in the last 2 days. NBA games are getting canceled because of team outbreaks. And as Robin Gill reports, even Canadian hockey teams are not spared.
The Vancouver Canucks quickly canceled the morning skate. 2 players have tested positive for COVID-19. More tests are being done, and it'll be a last-minute decision if tonight's game against Columbus is canceled.
We live in a different world, and we all have to make adjustments to it, and we'll adjust to this situation.
The Calgary Flames have at least 9 players out of action under the NHL's COVID protocol.
Everybody's dealing with it throughout the league, and you don't, to pinpoint where it's come from or where you got it from. We haven't done that yet.
All of this is having a domino effect on the league, postponing games and icing players. Boston, Calgary's last opponent, just put 2 players in quarantine. Despite the masks and vaccine passports, some medical experts are saying it's time for fans to stay home again.
I think now is the time to err on the side of extreme caution. We're looking down the barrel of an incredible Omicron wave.
COVID-19 is taking down teams in the NBA too. 10 players and staff with the Chicago Bulls are in COVID limbo. They don't have enough personnel left to play, postponing Thursday's game against the Raptors.
There's going to be ups and downs, but just trying to stay positive and continue to follow the rules.
It feels like pandemic deja vu all over again.
Wasn't something that was easy to go through last year. And nobody wants to get in that same situation this year.
This time, though, hockey and basketball have very high vaccination rates. But Omicron is a new and unknown player. Robin Gill, Global News, Vancouver.
Ahead, the search for lost loved ones after Kentucky's tornado disaster. A truck carrying gasoline in Haiti crashed and exploded on Monday night, killing at least 60 people. And a warning, some of the images are disturbing. There are reports the truck was trying to avoid an oncoming motorcycle when it flipped. Dozens of people were injured. The Haitian Prime Minister has declared 3 days of national mourning. In Kentucky, more than 100 people are still missing and feared dead after those devastating tornadoes ripped across the state on the weekend. Search teams are still sifting through the debris, and residents are attempting to clean up and assess the damage. At least 74 people died in Kentucky, and the state's governor says they span the generations.
The age range has gotten even harder. It ranges now from 2 months to 98 years of the Kentuckians that we have lost, some not even getting an opportunity to experience this life.
More than 20,000 people are still without power in Kentucky, and some counties are under a boil water advisory. At least 88 people were killed when multiple tornadoes hit 6 states. TikTok trades next, how one bobby pin led to so much more.
You're watching Global National.
If you are skeptical about the power of social media, this next story might convince you. A woman who used the popular app TikTok to barter her way to a house, and she started with nothing but a bobby pin. As Mike Le Couteur reports, her motivation was not about seeking fame or personal gain.
We're walking up to it. This feels so surreal.
It started off as a lark, a pandemic time waster.
Oh my God!
Yet now Demi Skipper has her very own house, when all she started with was a bobby pin. It's actually quite simple. Skipper was inspired by a Canadian man who once traded a red paperclip all the way up to a house. So she went on TikTok
and let's get this house.
And started trading.
And then about trade 2, the second video, it started to catch steam. And so I'm like, hey, I think I did a thing. Like, I think something's happening.
Something? No kidding. She now has an influencer's dream 5 million followers. In total, she did 28 trades. Earrings, glasses, vacuum, snowboard, laptop cameras, shoes, and more shoes. All the way up to multiple cars, tractors, and then an exclusive gift card to the Chipotle restaurant chain that gives its owner unlimited burritos for a year. And that's when she caught the eye of Alyssa Sager in Vancouver. As it turns out, Sager loves Chipotle, so she took the card in exchange for a solar-powered trailer that her flower shop no longer needed. Skipper then flipped the trailer for that house in Tennessee, and that's it, right? Well, no, because when Sager gets the card in January, she won't be filling up on burritos herself. She's going to donate the food every week to local shelters.
I think the more that we can do to level up the happiness, flowers make people happy, giving makes people happy. I think the more that we can do, and because we can do it, why not, right?
Skipper is a kindred spirit. She started the project to prove it was possible, and now she's going to pay it forward.
So I think I'll stay for all of the renovations. So the plan I think I'm going to do is that I'm going to then trade the house for a bobby pin again. So I'm going to donate whoever really needs this house.
It is the season of giving, after all, so she says, why not do it all over again? Mike Le Couteur, Global News, Toronto.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is downtown Calgary. We'd love to see your Canada. Please email it to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.